Hello, and welcome to our show. We're here and excited to provide you with tips for how you can find access to trustworthy information and why you should do that. My name is Dr. Reed Tuxson, and I am the chairman of the board of the Coalition for Trust in Health and Science. And this town hall is brought to you in collaboration with the National Consumers League. The National Consumer League provides government, businesses, and other organizations with the consumer's perspective on concerns including child labor, privacy, food safety, and medication information. It has emerged as one of the most trustworthy institutions in the nation today. Our purpose today is to help you, to have the tools and the guidance necessary to make scientifically informed and personally appropriate health decisions for yourself, for your family, but also for your communities. Joining me today to discuss this important topic are three really outstanding guests. First is Dr. Helen Burstyn. Dr. Burstyn is the CEO of the Council of Medical Specialty Societies. And let me tell you why that's so important. The Council of Medical Specialty Societies includes more than 50 physician organizations representing more than 800,000 of our nation's physicians. I'm also pleased that Raman Bastani is with us. He is the CEO of HealthVana. HealthVana is a company that helps engage, communicate, and assist patients by delivering actionable information via mobile phones. Since 2015, the company has helped facilitate tens of millions of interactions between patients and their healthcare providers. As Raman jokingly says to me, we make healthcare suck a little less. And also joining us is Robin Strongen. She is the Senior Director for Health Policy at the National Consumers League and one of the great advisors to our Coalition for Trust in Health and Science. Well, thank you all for joining us, and let's start by setting the stage. Let's talk to our audience about why this topic is so important and what do each of you hope that our audience will learn today. And Robin, let's start with you.
Okay, great. Well, consumers are in a bit of a really tricky place nowadays, and they're in a real pickle. When I use the word consumers, I'm talking about people who are healthy, but I'm also talking about patients who are looking to access the healthcare system. And when we talk about patients, we also include caregivers, their family, and their loved ones. So really, everybody at some point is going to be a patient, whether it's to keep him or herself healthy or they need access to some kind of information. And everybody wants to be a good advocate for their health and their loved ones' health. The problem is it's very overwhelming. It can be very overwhelming to find the information that one is looking for. And there are really two buckets of reasons why we find when we talk to consumers, this is the case. One has to do with healthcare systems and one has to do with the individual. And I will take just a moment to elaborate a little bit. On this, what I call the system side, we know that it's really important to keep in mind that science evolves. What's true in medicine today may not be the same tomorrow. And that's not because scientists and researchers got it wrong. It's because they're always learning new things, new diseases, new viruses, new information. We're always learning. That can be very confusing because as the scientists are innovating and learning, it changes what we call a standard of care, which can be confusing to someone who's trying to keep up with, well, last year you told me to do this, or don't eat this, or go walk this many. This year you're telling, what the heck do you want me to do? It's not easy. Then we also know that there is a legacy of mistrust in the research and trauma community. Those things are hard to heal and we don't forget. And that comes along with a whole trust situation when we're looking for information. And lastly, I'll say something that is also difficult for those of us who are not trained in medicine is you can have really brilliant scientists and physicians and health professionals look at the same data and come to different conclusions. It's why we go as patients for second opinions. So there isn't always an easy answer, but understanding where understanding where we go for information that we're comfortable with is what we hope the audience tonight will be able to make their way through. And the other thing I mentioned on the individual side very quickly, we want to make sure everybody, that means young people sometimes don't like to question authority figures. People in white coats can be very intimidating for people to question. People who are young, statistically, we know they are more comfortable getting information from TikTok influencers other than maybe trying to make an appointment and going somewhere to a clinic. And so, it's just easier online. Doesn't mean it's better. It means it's easier. English as a second language for consumers who don't speak English comfortably. It's hard enough to make your way through medical language and so on. Really tricky. And the last thing I'll say is stigma. And this is where I know Raman has done a lot of work in this space, but it's not always easy to ask for the help we need from, because of privacy, because it's embarrassing, because of discrimination and so on. And overlaying all of this, we have the internet, which is rocket fuel for sharing really bad information.
Well, you have really opened the door, Robin, to a number of really
stop and give you guys a chance.
Thank you. No, that's just what we wanted, because you're speaking the language of our audience. Great. And this show is for our audience, not for us. And so you've got a lot that we will unpack as we go forward. But I'm glad you passed the baton to Raman. And okay. Raman, let me just ask you the same question. Why is this topic, based on all of your experience and all of those health interactions that you do every day, why is this topic so important? And what do you hope that the audience will get out of this conversation?
Yeah, thank you for having me on this. So I think the most important thing to remember is we just, as a company, all we try to do is help patients make better decisions in their health. We don't necessarily say this is right, but you treat everyone with respect and you meet them where they're at. And where everyone is that we work with, whether it's underserved populations or anyone else, is on their mobile phones. If you don't have something that works on a mobile phone, and don't make anyone download an app. That's just dumb these days. Like, you just want it to work on the mobile web. You want it to be instant, and you want it to be quick to get them what they want. The thing we think a lot about, Reed, is anxiety. Where is their anxiety that we can address? And if you can address that, that's where you start to build a trusting relationship with someone, whether that's in person or, in our case, using technology. So an example would be if you're delivering a test result or something that's super sensitive, the patient and or their family is nervous about. If you can deliver that in a way that's really easy for them to understand and helps them get to whatever that next step is, that's a big win. And the likelihood is they'll come back to you. So for us, it's about helping people make better health decisions. And it's an important topic because we're seeing so many people put off care. We're seeing so many people not want to go to their healthcare provider. And we have this view very much that the internet and now generative AI can help bridge a lot of those gaps that we're seeing in communities. So we actually think this is going to be a big bonus for underserved populations. And one thing, we have one of the leading AIs in a patient setting today across 15 states. So this isn't just me trying to pretend to look at studies and like kind of assume where the future is. We're doing this with tens of thousands of patients now across the country, where they're talking to an AI, in some case a drag queen AI persona, just to get information back to the patient in real time. And my God, the feedback is something we did not anticipate. Patients prefer talking to the AI versus a lot of times what they would say with a human.
Let me make sure that the audience is fully plugged in on all of the terms and terminologies that we use. Would you just spend a minute just to describe what is generative AI?
Yeah, it's imagine talking to the computer and it talks back to you in a way that's intelligent. I think that's probably the simplest way of saying it. So we call it conversational AI. And when it comes to healthcare, we think it's always about conversations. And so that's probably the best way to describe it, Reed. And that's how I describe it to my mom, who is older and uses it now. And we immigrated from Iran, so she speaks Farsi better than she speaks English still. But she now uses ChatGPT to speak into it at her doctor's office in Farsi, and it comes out in English. And so we're already seeing the impact.
There's something else you said. I just want to make sure you talked about the word anxiety and how does being anxious play into why we are concerned about this challenge of misinformation and disinformation and lack of trust.
I think when we're all scared, whether it's for ourselves or loved ones, we're clamoring for information. And a lot of times, whoever that person is that you're going to for that information isn't available. It's not their fault. Maybe it's 3 a.m. and you're nervous about your kid, and maybe it's about your loved one. And so the better you can address that anxiety on a 24/7 basis, and I'm not talking about going online and searching. I think we so used to Dr. Google. I think it's going to move into Dr. AI, and you want that to be from a trusted source, which I know we'll get into. But that's where we see a lot of the future going, and it already is happening in that way, but even more so with the use of generative AI.
Thank you. Helen, you obviously are in touch with what's happening on the ground in the very sacred place between clinicians, physicians, health professionals, and their patients. How do you see what's going on here? And again, what do you hope the audience gets out of this?
Yeah, thanks so much. And I'm going to steal conversational AI, Raman. That's a great way to describe it. I'm going to use that on my family. I think it's great. I really hope that the audience leaves this conversation feeling more comfortable, that there are ways to, in fact, navigate all this barrage of information coming at us on the web or ChatGPT or whatever the source may be, and try to figure out a way to actually identify what's credible and what's not. Because we have seen real patient harm. I mean, the outcomes here are real. We saw this during the pandemic. You certainly saw this with the amazing work that you did with blackdoctors.org and really trying to increase vaccination for the African-American community. We saw the amount of misinformation and disinformation, and we'll explain those to folks in a bit, that we saw that clearly suggested that you shouldn't get your vaccine. You shouldn't take Paxlovid if you're older and sick and need it. And I think patients got harmed by a lot of that. We think of what happens with childhood vaccinations and the amount of misinformation we've seen there, and communities losing their ability to have community level immunity and starting to see measles and things again that I've never seen as a doctor, and I'm old, right? So some of this stuff we've just got to get our arms around. How do we make sure? And I think this is a really important place. We actually just gave a talk about this just last week at the PCORI meeting. I think the sweet spot here is, in fact, having clinicians and their patients work together to use AI, work together to identify the most credible sources, and that you do feel comfortable coming in and sharing, hey, I read this on ChatGPT, or I read this on Google, or I just want to get your perspective on it. But if I can then direct people to where those credible sources are, that can be a real game changer, because we just have to do that. And I really appreciated all of Robin's comments about the rapidly changing evidence space. It's real. And I think the best person to help explain that to you and with you, I think, is your clinician. And Reed, as you and I know from lots of research that we've been part of, the person that's still the most trusted source to get your health information from is your doctor or your nurse. And so we need to make sure that doctors and nurses have the tools they need to do it better. What resources should be in my hand as I sit down with a patient and have them navigate? Do we need additional people in our offices, for example, in clinics and health systems, who can help people navigate the web, navigate all these new tools? And really importantly, and I was glad Robin brought up the issue of underserved populations. Got to be really aware of tequity. I mean, there are still a lot of populations who may have a phone, but they may not have a data plan that allows them to really use and look for information in quite the same way. They may not understand how to use ChatGPT, but there is a revolution coming in terms of AI. Completely agree. I think this ability, for example, of ambient AI, being able to capture whatever the discussion is in your mom's exam room in Farsi and put it in a clinical note for the doc, is a game changer.
Wow.
And I'm really excited, but it has to be done right. We have to have transparency. We have to understand whether these tools are in fact fair. We have to understand whether there's still differential access. And we have to make sure that we're directing patients to where they should look, where we believe good information resides, rather than what can really be some very frightening places on the web.
Well, I'm going to turn in a minute to Robin and ask her to help us to define these terms, but I want to just lock in, Helen, on really the passion that I hear coming from you as you're talking to this audience. I think what you're really saying, though, is that, listen, folks, information determines whether you will do the right thing or not do things that will help you to live or that will compromise your ability to live. That this is really important. This is about you, your life, your children's life, your family's life. And it's also about the life of the people that live in your community. And if you're acting on bad information or not acting on good information, the outcomes can be, and we know are too often, tragic. That's why we're doing this show today. Robin,
Exactly.
help us understand, what is misinformation? What is disinformation?
Okay, so I think a couple of things are really important for people to bear in mind when they hear these terms. The first is misinformation and disinformation is by no means a new phenomenon. It has been happening since the beginning of time, since we started communicating with one another. People have had agendas. People have wanted to be helpful, but maybe get tripped up inadvertently along the way. And so they're sharing jumbled information. And I think to really understand what we're talking about when we're talking about mis and disinformation in a healthcare medical frame, if you will, I think it's important to start with what is information. And so I looked, just to give credit where credit is due. Johns Hopkins had some nice materials. And so I'm sort of borrowing a little bit of what I read there. Okay. We start with data. So something, for example, like 8 million or 9%, that's not information. They're bits of data. If, however, and I'm quoting here, you use that in the following way, the population of New York City in 2000 was reported to top 8 million persons, a growth of 9% since 1990. That is information. You've taken the data, you've turned it into information. But to have value to someone, that information needs to be useful for a given purpose. So we now know New York City had this growth. There are a lot of people. What are policymakers going to do with that information? How are they going to determine what public health services are needed? How do they make sure? So for an individual, this use of data and information is really important as long as it's accurate and not biased. And if it is biased, that it says it's biased and it lets us know. So we need to understand that information has a value and a purpose. But what happens when information is not accurate, or it's false, or it's being spread in a way that is not helpful and can be dangerous, that is misinformation. When it's done deliberately to deceive or to harm for whatever purpose, political, financial gain, propaganda, whatever reason, that is what we call disinformation. So
Right.
misinformation is the sharing of inaccurate, potentially harmful information, but it's not intended and meant to harm someone, but it can still harm someone. We know that if you listen to advice online about skincare and sunscreen and all these, it can get very complicated very quickly and be very dangerous. So we have to be very careful. But that's really the distinction we're talking between mis and disinformation.
So Helen, you are a researcher in this topic and you've looked at this a lot. Your take on the definitions, which Robin has really opened the door quite wonderfully for, but also I'm curious to see what you think in terms of whether or not we're seeing more of this than we had in the past.
Yeah, no, that's a great question. And I completely agree with Robin's definitions. I think they are about spreading, the misinformation versus disinformation, really having the intent to cause harm. Unfortunately, I think even good people can spread bad information and cause harm.
Yeah.
I do think we are having more health misinformation now than we did before, but that's just because we've got this capacity, this electronic data source that makes things go like fire, right? We just have a flame that allows information to go so much faster than it may. And Robin's right, right? We've had snake oil salesmen for years. You and I have known docs over the years who have been charlatans, right? But they didn't get the kind of reach they can get by doing some, cute video on TikTok. And that's scary. Now, one of the things Robin said, I want to be cautious of, because you did say if there's bias, they'll let us know. I don't think that's true. And I think that's actually one of the other big pieces of work that we did, as you know, Reed, working closely with the National Academy of Medicine, WHO, for Google and YouTube. It is not always apparent, in fact, whether information is biased. And it should be. It should be very clearly labeled that says, it says sponsored or sponsored by, or this is a sponsored, and it's oftentimes kind of deceptive. And we went through the criteria to identify what were credible sources. One of the most important factors is whether or not the person who's sharing that information is being paid to share that information. And with that, does that come with some biases inherent that we just have to be incredibly cautious of? And I'll say every once in a while, just for my research, I'll look at TikTok, and it's remarkable how you could be halfway through a video before you figure out that somebody then holds up a product, right, that you didn't know at the beginning. It seemed like it was going to be a really good, useful talk about healthful eating, and, and all of a sudden they're showing their supplement that they sell.
Yeah,
So
exactly.
consumer beware, be really careful of ads that say sponsored. Look for what we worked with Google and YouTube to do, where there's a very clear shelf, as they call it, on YouTube videos that says this is from a trusted source.
We're going to come back to that. And I'm
Yeah.
going to want you to repeat that again, because that is really key. Raman, you're in the middle of what Helen describes as this flurry, this hotbed of movement of electronic information that is making this problem more challenging. What's it look like from your point of view? Are we seeing more misinformation? And if so, why do you think that is?
I'm learning a ton. I should start by saying that, listening to how you all are thinking about this. We go down to something that's pretty simple for us, and that's just really helping a patient make that next decision in their health. And we're working with healthcare providers in a lot of cases. One of our customers is the County of Los Angeles with 10 million people. That's bigger than 40 states on their own. So we're seeing a lot of this type of work. And it is a challenging problem. There's no doubt. I still am not clear if the Surgeon General of Florida says that, COVID vaccine isn't good. I don't think there's bad intent. I think he believes that. So it's a difficult thing. And I know people will disagree. I could see, Helen, on your face. And what we do is we try not to get involved into that, but provide information to folks from trusted sources where those may come. It's going to be a challenge no matter what. We look at this as kind of the juxtaposition of people talk about the fears of AI and hallucinations. When I go to TikTok, and it's 175 million Americans already on there. So I'm much less concerned about what's happening with generative AI and how that's coming out with brands and such versus what's already out there. But it is a really challenging problem. But for us, the folks that we're talking to are just looking to help move to the next step in their healthcare. They've got a couple jobs, they've got a family. They just need help with that one particular thing that'll get them that next piece. And hopefully, as you said earlier, Helen Reed, it's with their trusted healthcare provider. A lot of times the information, misinformation or disinformation will come from them. So it's all over the board. And I think it's a really challenging time.
Well, let's start getting into helping the consumer then to make sense of all this. I think that one of the things that concerns me greatly is that too often I am seeing across the country that people are making decisions based on what their group wants to do, their political affiliation wants to do. They're being influenced, sort of almost like we become almost little health tribes where information circles, either bad information or good information. And that concerns me a great deal, because what we really want people to do over and over again is to be able to access evidence-based, science-based information, and then make your decisions based on the veracity, the truthfulness of the science, as opposed to a lot of people on TikTok's opinion who may not and usually have no idea of what they're talking to. Helen, help us to start to begin to understand, how does the average American who's watching this show, how can they detect if information is accurate and if it is in fact science-based?
Yeah, no, it's a great question, Reed. And I think the first question really should be, look at the source, right? If it's coming from a respected source, if it's coming from a nonprofit, the National Consumer League, if it's coming from the Mayo Clinic, a health system, if it's coming from a physician who you trust, that should give you a slightly higher sense that that is a trusted source. When we worked with the National Academy of Medicine and Google and YouTube to create these shelves, we came up with a series of criteria, like to actually you should look to see, who is this person? What is their background? Do they have the expertise to be talking about what it is they're talking to you about today, right? If it's a dermatologist who's giving you advice on COVID vaccination, well, no offense to my dermatology friends, but that may not be the first person I want to get that advice from, right? Do they have a vested interest in the outcome? Is there some financial model here that they get some remuneration for sharing information that may not be true? So I think some of those are the key things. The other really important thing is to break the cycle of people searching for information, and the first thing that comes up is the information that went viral. And we saw a lot of that during the pandemic, right? The first thing that comes up when you search for something was the video that got seen by millions of people, even though it was false. And that's where I think working with our search engine friends like at Google and YouTube, and I hope ultimately groups like TikTok and others, to say, can we at least adhere to a set of principles that it isn't just the first thing you see is the most viral, but what you see is the most credible. And I think that's an opportunity. So if you're looking at videos, for example, look for the shelf that says, this video is from a trusted source. It should come up first, as opposed to the viral videos that used to come up first. But that's really just on YouTube, and Google is now using AI to do some of that as well. But I think we need to now work across the other sources like TikTok, Instagram, and really just buyer beware, be really cautious of those videos that have little tiny print that said sponsored.
Great. And Robin, again, from your point of view, what are the kinds of ways that you are, through the NCL, are hoping that people will learn how to detect whether information is accurate and science-based or not?
So we're there's never one answer, because everybody has access to different sources of information, whether they're people. You guys talked a lot about the trust in physicians and nurses. We do a lot of work with pharmacists who are also very highly trusted and very knowledgeable medical intermediaries. They're often the first person somebody will ask many questions that they may not remember to ask their physician, or etc. And so we are always looking for what is a trusted source of information in the healthcare workforce that we could help educate how to talk with consumers. I also want to mention that part of our project with tonight's program is a toolkit that the Coalition and National Consumers League put together, long day, which is specific on answering these questions. It has many resources that we won't get into here, but online, and we can give the web address before we close out. It will either be on National Consumers League, which is nclnet.org, or the Coalition website, and it's free, and we are having it translated into Spanish and other languages, and it is easy to read, and all you do is click and it goes to all the different sources of what we're talking about tonight. So you don't have to remember everything and write it down this evening. Yeah. But it's a number of different ways. One of the challenges with misinformation is sometimes there's a kernel of truth to something that you're hearing. So being able to help consumers understand that when you're sick, Raman knows, when you're scared, you are quick to go to information that you want to hear. Denial's a beautiful thing when you are faced with, it's very hard. So we are working on how to talk with your friends, with your family who may have different points of view. People, don't see things. Just look at end of life. Everyone has different feelings about things. Same for all of the struggles we have throughout the lifespan. So there is no one answer, but there are resources. Many universities, and we have some of these in the toolkit, have specific online tools so you could trace and see if something is actually a rumor. You can see if something is a bot. A bot is a robot, it's a fake person, and it's just passing on information. So there are tools and there are techniques for speaking with your family.
I think you're right, Robin, and it is a complicated puzzle. And so we do, as you've indicated, put a lot of energy into this e-booklet, which is we're putting up on the scroller.
Yeah,
that's out there, so people will be able to go to that. But I think what I want to just make sure we're really clear about is, first of all, folks, what our panelists are saying to you is beware. That there are a lot, unfortunately, of people who are trying to manipulate you in one way, manipulate you for reasons that may not be in your best interest. Number two, pay attention to what's being presented to you and who is saying it. How accurate is it? How current is it? Is this information that is recent? Is someone, are they sharing something that was a study back in 1912? Or is this something that is new and there? Think about making sure that you're not being manipulated to do things that are outside of the norm of what your physician, your nurse, your pharmacist, your health profession is saying to you. And by the way, go talk to them. They are now in a place where they know they have to spend more time with you. And so this is very important. Look at the sources of who's providing this. And please, above all, I think what both Robin and Helen are saying, and I'm going to turn to Robin in a minute, I think what both of them are saying to you is beware of just somebody popping up on the internet, on a social media platform saying, I know what to do. They have no degree, they have no expertise, they're not part of a group of trusted scientists who have worked on these issues all of their life. These are the things you want to be careful about. But Raman, how do you sort of talk to, I think we're just going to decide that your mother is now the star of the show. And so when you are talking to your mother about how to access trustworthy information, what are the kind of things that you are warning her?
It's a struggle. So as immigrants, you don't trust the healthcare system a lot of times when you come to the US because it's different. Doctors are paid to do things. And a lot of times you're wondering about what the incentives are. And this is back when we moved here, 40 plus years ago. So none of this is new. Some of that's already inherent in different populations for different reasons, all absolutely worthwhile to consider as a part of this. And so Reed, the struggle is she hears from her friends. That's more important than hearing something on TV. She's not on social media. So it's kind of what happens locally amongst the community of people talking about things, and people vary in their opinions. It is a gray area for me in a lot of cases. There's some that are absolutely on one end of the spectrum, but I think you dissuade a lot of people from listening when you say that there's absolute misinformation on this side, and it comes down to political parties a lot of times lately that we've seen. And so I think people really do pay attention when they're most scared, which is why I continue to kind of hit this. When you're most vulnerable, it's when you're most scared looking for information on something, not necessarily a vaccination, which you might be like, well, maybe I just don't get it. But when you're really in that position of like, what do I do about my health? And yet people trying to guide you down that path, the information that you all have been sharing about is incredibly helpful. But it's a challenge. She listens to different types of radio. She listens to her friends. And she doesn't want to get vaccinations in some cases. And I don't blame her. I just try to be there for her alongside.
Well, since you mentioned the word vaccination, let me turn to Helen. And Helen, I think one of the things, it looks like you were getting ready to make a comment on that, but related to that.
Ask you to say something, but that's okay. You can ask me first.
No, but listen, I want to take this issue of vaccine straight on, because this is probably the most important example that we've had. Here we've had a vaccine for COVID that was proven extraordinarily to be overwhelmingly safe and definitely overwhelmingly effective. And yet so many millions of Americans were dissuaded from taking a drug that would have helped save their lives and the people around them. How do you as a clinician react to that? And how do you sort of guide people like Raman's mother to try to be more comfortable when we make recommendations about a proven safe and effective vaccine?
I'd be happy to see your mom, by the way, Raman. I think it's a great question, Reed. And actually what I was going to ask you to answer when I'm done is I think one of the other really important things we learned, and you demonstrated this beautifully during the pandemic, was how important it was also to have those trusted voices come from your community. Yes. So the work that Black Doctors Against COVID did in terms of going into communities and having your trusted voices in the Black churches, having your trusted voices on the radio made a huge impact. And so I don't want to lose sight of that because I think it's really important. And I think, feel free to say more about that. I think what's been unfortunate is we've seen a sad connection between what people believe, particularly about vaccination, and their political affiliation, which is also disturbing because I think part of that implies we're all listening to different news sources. We're not communicating with each other. So I think that's really dangerous. And we continue to see this in our political climate right now as well. So I think being able to be really open with patients, hearing what Raman's mom's concerns are about vaccine, what is she worried about, I think is really important. And the work that we did together, Reed, for the coalition, where we really looked at what the evidence base was and what strategies work. One really important thing when you're talking to patients who might be hesitant about vaccines is, in fact, providing an open communication so that patients can feel comfortable questioning something and you responding in a way that doesn't just say, well, you're wrong, let's move on, right? You have to have that open dialogue. So I think you have to feel comfortable that you're with somebody who's going to work with you to hear your concerns, kind of feed, repeat back to you what they've heard, give you the best possible information, and then help you be able to make what is the right decision for you and your family, which hopefully will follow evidence-based principles. And we've seen some great work done around even this concept that one of the professors we worked with at Harvard has looked at, this concept of disagreeing better, where you open up conversations instead of close them. And by opening up conversations between a patient and their clinician, you're going to have just a very different dialogue than you would if you just say, you know what, you need to get it. I don't feel comfortable taking care of it because you're not getting it.
I like that. I like that a lot, because what I think that we are now learning from the pandemic, and Robin, I'll be curious to see what you think about this, is that we are learning how important it is for health professionals to not only give consumers and patients information, but to listen to consumers and patients. I know that, as you mentioned, Helen, with the work that I was lucky enough to do with the Black community, there's perhaps no community in America who has been more targeted with misinformation and disinformation. We were bombarded with it. The good news is that having the community itself come together and say, look, we want to have better information, and we need to have trusted voices that we know and care about, our pastors, our physicians and nurses, and our social leaders, all coming together as one unity, talking to our community. And the results were remarkable for us. The number of lives that were saved in the Black community from COVID was unprecedented in our experience with any disease that we've had in modern time. So we know that when you give people information through trusted sources that is accurate, non-biased, understandable, and give them a reason for using it, i.e., let's try not to have people die when they don't need to. Let's have our kids not suffer when they don't need to, that it can make a big difference. But Robin, as you kind of look at all of this, how do you sort of see, this sense of how we need to listen to consumers and the voice of consumers, so that we're not talking down to people, but, as I think Helen sort of gave an example, talking with?
Yeah, and I really appreciate that. And I have three thoughts, because we hear a lot of, not from this conversation, but out there generally, we hear a lot about patient-centered this and that, and value-based this and that. And sometimes we think it's a lot of, pardon my French, BS, because it's checking a box that isn't really listening to the patients. My husband has very advanced dementia, lives in a facility. I have never seen anyone from any community come and meet us where we are. I do all the talking, never. There's a lot of lip service to dementia work right now, whether it's digital health and they're gonna, do this and that, and there's great things, and the doctors are doing this, and I've never seen this, and I'm there all the time, not once. Number two, I think when we talk about trusted sources, I think we have to talk about the media as well, because a lot of what we used to call media are really opinion now. Everything is a media. And how do consumers understand when someone's giving health information in the media? Is that trusted? And again, in the toolkit, we do have ways to verify the accuracy, whether that is a healthcare journalist who's part of an association with credentials, and for a consumer to understand, because again, how do they navigate whether that's trusted and reliable information? And the third thing I will say is, in terms of a trusted voice, oftentimes it isn't someone in the medical field, it's someone who is a liaison, who can get the information. One of my favorite examples is years and years, decades ago, we were doing work down in Texas at the border with some first-time moms, and they only spoke Spanish. And it was early on when rear-facing car seats for newborns were new. and the uptake for moms wanting to put their infants after they had delivered, they're going home. There was a gift from the hospital, nothing doing. They wanted to hold the baby. They felt that was much safer. There was no how, no way they were sticking a kid facing backwards. That seemed ridiculous to them. And the public health community tried every which way. They brought in grandmas with dialects to appeal. They brought in siblings. They brought in people from CDC with data out the yin yang. Nothing doing. It wasn't until they lined up all the car seats with the moms there, and they got the parish priest with holy water to sprinkle on every car seat and bless them. 100% uptake, because that was who the moms trusted. It's the same information that CDC tried to tell them. This, it's just there needs to be that visceral trust, and you have to hear what the fear of the person was. And until we have those really raw, honest conversations where people are coming to the site, we need to do more site visits. We used to do this all the time when I worked on Capitol Hill. We would take staffers off the Hill into the bayou. All the great laws they were writing, all the great policies, they forgot that toilets don't always flush and that roads sometimes are muddy and you can't transport, even if you gave money for ambulance service. If the mud makes it impossible, you have to be on the ground and see how people really live. Then you can make your policies.
One thing I just want to stop for just a moment, and it's core to this conversation, and that is our willingness to care for each other, our sense of compassion and empathy for each other. I just want to thank you for being so transparent, for sharing your own personal journey, your personal challenge with us. And I think we always have to, as a community of caring human beings, take a moment and say, thank you. It matters to us. We're sending you our love and our support. And then we go from that to making sure that how we act after that, again, is informed by the best information, the best thing, so that our good intentions are translated into effective interventions. Thank you, Robin, for sharing that. I want to move quickly to something you mentioned earlier and get Helen to help me out on this. Earlier on, you talked about, in fact, your very first comments were about research and how things change. One of the challenges, Helen, that you are facing with your 800,000 physician members is that we have always this sense of new knowledge, new research, things that we thought we knew, now we update it. So it's going so fast, Helen. How concerned are you? But what are you all doing in the Council of Medical Specialty Societies to help make sense out of this constant? And by the way, this isn't a bad thing. My goodness. Oh, terrible. We're learning new things every day. How horrible.
Yeah, no, I think it's a great question. And I think all the organizations are thinking about it differently. But I think one of the most important things is to put information out in a way that meets people where they are. I think actually, and thank you for sharing that, Robin, the power of stories is also really, really impactful, especially when the stories are, that was one of the lessons we learned from Professor Minson when she did some videos for us around this topic of talking to patients who are vaccine hesitant. Don't just share stories, share real stories, exactly what Robin just did. That ability to put a human face on. I've always loved this old statistic of statistics are just stories with the tears wiped away, right? Like, how do we just make sure we embed it in a way that people need to react to those things? They need to feel the way we felt when we heard that, Robin. So I think thinking about how we get to patients where they are, give them information in a way they can understand it, make sure you understand. Are you using the app if you're in a health system that has an app? Do you know how to use the app? Do you have somebody who can help you use the app? Those are now really important. Actually, there's a wonderful talk I saw about a year ago by Karen DeSalvo, who's the chief health officer at Google, where she said that information is now a social determinant of health. So we have to make sure that patients can access the best information. And as that information changes, the more they trust us to say, hey, there's going to be some new information in your portal about a lab test I just ordered for you because you're really high risk for heart disease. I'm going to talk to you about it when that result comes back so you really understand what this means for you and your family. So as we get new science, genetics, genomics, I'm talking about lipoprotein A, for example, some new evidence that might be really important for women in heart disease. Being able to explain that in a way that resonates with patients shared information with them as well that's understandable, like taking information and putting it in language they can understand. I'll just give one other quick story. One of our societies, the College of American Pathologists, has been doing a research project with us, funded by the Gordon and Betty Moore Foundation, where they were trying to make pathology reports, which are pretty opaque, more readable for patients. And they did focus groups with patients. What was really interesting is patients said, don't dumb down the language for me of the pathology report. Leave the pathology report as is, but have a glossary for me so that I can know what those terms mean. So that when I sit in front of my doctor or my nurse, the words they're using are the words I recognize from the pathology report, but then I'm armed with the information to understand them. I thought that was a really powerful
That's a
lesson.
really good one. Raman, I'm going to come to you in a second, Raman, because I'm curious about how communication occurs on these mobile phones. But Helen, I think what I just want to make sure the audience is really hearing from you, and that is that healthcare professionals really do want to get it right for you now.
Absolutely.
And so, this is a very challenging time. And we really do appreciate that there can be great confusion when you're bombarded with all this new information that constantly changes, and you want to make sense of it. So make use of your health professional, your medical home, those people there. And if they don't know the answer, they'll get you the answer that you need. And if you still don't understand it, ask it again. We don't go to all the trouble of diagnosing a disease or finding a cure only to have it not be used or have it not lead to the best health outcome. That's why we do all this work. We want to get it right. And you, as the consumer, it's your right. In fact, it's your obligation and your duty to make sure that you ask. Say, look, I read something. It doesn't seem to comport with what I saw at the CDC website. By the way, where does Helen get her information? Where do I get my information? One of the main places we go, always, the Centers for Disease Control website. It is absolutely top drawer. You can have confidence in it. So use that. But Raman, if we're going to be listening and having community engagements and working with organizations and trying to be really present in the community and communicating, but now we've got this cell phone and how are we going to have good communication on that?
Yeah, a lot of great learnings listening to you all. One size does not fit all. I think we all know that. This you all may disagree with. More information is not better. One of the biggest problems we have, and why I said this is such a difficult time, is because we have access to more information than ever. There's a historian, Yuval Noah Harari, talks about this in his book called Nexus. The idea is talking about AI. More information is not better. I don't think people quite understand that yet. And the access to your doctor is not there for most of the folks we work with. It's just not. And if it is, it's a couple of minutes, and it takes a lot of courage to ask a doctor a follow-up question. I've done this as a caregiver where it is hard to then, because you're under the clock, you have a couple of questions ready. And it's where we see technology playing a role to actually help, not replace, but supplement on top of what's already happening. And another example for that one, Reed, is we're doing a study currently with some researchers at Stanford on AI. One of our customers is who uses HealthVana as their patient portal for patients. Over the last couple of years, I think 33,000 messages were sent by patients to their healthcare providers. This is across probably 17 states. 13,000 of those were never viewed by the healthcare provider.
Right.
Those aren't bad people. They're great people. They're super busy. There's staff shortages. They can't get to everyone, and they're busy in the clinic all day. 13,000 people sent a message, never heard back. That's why we implemented AI, to give patients the option to instantly get information back in a way that's helpful for them. And what we've seen is, in this case, it's not necessarily more information, it's bits of information that's really working. So you talked about the cell phone, Reed, right? If you use TikTok, why does TikTok work so well? It's those first few seconds. Why does YouTube work so well? You capture attention. So the idea, again, one size doesn't fit all, but we are trained now to share little bits of information and ascertain certain things from that. And you associate with number of views to go along with whether or not that's credible, all the things that Helen's working with. We used to work with some folks that ran Google Health 12 years ago looking at these things. So this is only going to continue to get broader and broader. And so, and doctors just aren't scalable. Neither are their staffs. Their burnout levels are extraordinarily high. There's incredible folks like you all working on things to get this out. There's different ways to utilize technology to then empower and extend the power, amplify the power of what a lot of folks are doing. but it still does come with the trusted information, right? Who is the trusted source that the AI will come from, or the technology? Their apps for a lot of these healthcare providers are confusing for me to use, and I'm supposedly an expert in this. So again, more information is not better, which is why the conversational AI, you will just ask a question and then you hear back, and then you get to ask more questions, and it's instant, and you'll start to build a relationship with the AI, which is what we're seeing and we'll publish on. They'll lead to the patient to more trust, which means they'll have more likelihood to ask questions when they're nervous or scared to get help.
I think this is really powerful, what we have in front of us here. Now we've got a partnership that is brewing between consumers, health professionals, and information technology experts who are trying to say, okay, how do we use these new tools, these new capacities to do the right thing by patients to prevent disease and save their lives? I want to follow with you, Robin, but I see Robin's hand is up. Go ahead, Robin.
So what excites me about where I think for consumers, where the benefit is, and the reason I love traditional medicine has to keep doing what it's doing with its, evidence base and all of that, and CDC information. But the reality is there are millions of people on the ground who need information right now. And there is a big disconnect between sitting down with a health provider and getting what you need when you need it. A lot of homeless people, Raman works with a lot of homeless people. It's a very different access to care when you are homeless. And so all of this great stuff up here is not reaching folks, but the information can reach him through his technology, because even with the technology inequality, most people have some type of mobile phone, even when they're homeless or even when they're financially fragile. There are organizations and clinics that arm people with that technology. So my question as a consumer and challenge to the traditional health community is, how do we partner with people on the ground to make sure that when your bots, people are asking you, because I've seen it in action, they don't give health information. They recommend that, oh, we can't answer this, but here are 4 clinics where you need to make an appointment immediately because concerned you might be blah, blah, blah. How do we make sure that Raman has the right information? He is using really good generative AI, and I know you're doing the peer review work with Stanford, but there's other information. You are the conduit. You are the missing link. You are the last mile between the House of Medicine and people who are finding it difficult to really be part of that system.
So if I listen carefully to you, I think what you're really getting at here is that we've got to make sure that the origin of trustworthy information, science-based facts, and not crazy things that people just spout off for whatever reason. We got to make sure that the origin is pure, which I'm saying that the science criteria. And then you have to have a bridge to get that to an educated consumer population that wants to use the information because they want to save their lives. They want to make sure their kids are okay. They want to make sure they live in healthy communities. And so how do we make that bridge? And the technology is going to be in the middle of that. And people like Raman are going to have to be trusted bridge builders. Is that it?
Reed, can I give you an example, Reed, that I think hits this home pretty well? So we published a study in the New England Journal of Medicine Catalyst with the County of LA, some folks from Stanford. And this is during, towards the peaks of COVID when Paxlovid had just come out. So there wasn't that much Paxlovid. A lot of people didn't know about it. There was a lot of mistrust like you all are talking about. So the County of LA did some incredible work with us. They're just really bright people we worked with there. And they decided that in certain zip codes of the County of LA, there was twice as likely to be people that are hospitalized who got COVID in certain zip codes. There are these underserved populations, generally communities of color. So when we were already the ones delivering the test results for COVID, again, that moment of anxiety that I've talked about several times, you're delivering that information to a patient if they're positive or negative from COVID because they went to a county or city site. And in that moment is when you can say, like, you've tested positive. That's when you have their attention. And then you say, here's a medication that can help you for free. Click on this button. I'm not talking about anything complicated. This is extraordinarily obvious and simple things that you would find anywhere else in technology except in healthcare. And guess what? People ended up utilizing the access from the point of finding out about a positive test to a prescription in 6 hours. It was extraordinarily how quickly it worked, but it's such a common sense solution. And that's the bridge I think that Robin is espousing. And I think it's just it hits home the point of how it really does help people if you make it simple and if you capture them in a moment. If they're not thinking about their health, they don't want to think about their health from
Right,
our perspective.
right.
That's helpful. Well, listen, we're at the point where we're going to have to start wrapping up, and
Oh,
Raman, I'm going to do this what I call the lightning round, but I'm going to give you a hard question, unfortunately, to do in a very short period of time. And then after you, I'm going to go to Helen, and then Robin will get the last word of what we absolutely want to leave with our audience. But Raman, AI, and this is a hard question to do in a short period of time. AI can be a force for good, but we also know that it can confuse us because we may not know whether the person that is being presented to us is actually a real person or not, or what they're saying. Any quick advice around how concerned you might be around AI being used as a force for not good?
Yeah, extraordinarily concerned, but even more excited about the possibility to help. Cars kill people, planes kill people sometimes, right? We get better and better at these things, and anything that's this powerful is going to have that impact on either side. So it goes back to everything you all have been espousing. What's the source of who's the AI behind? Is it the Mayo Clinic? Who's it coming from? Where you get your information is the initial steps.
Beautiful answer. Thank you. Helen, what is the one thing that you said today that you want to double down, or the one thing that you will kick yourself in the behind after this is over because you didn't get a chance to say it?
Well, I'm not sure I know the second one until later. So I'll start with the first one, which is, I think, very much building on what we've talked about. There is incredible information out there. Some of it good, some of it not very good. Do whatever you can. Use this guide. There's some great information in here to help you identify which sources are credible, which are good sources to start with. Avoid sponsored posts. Be careful of those folks who are selling snake oil. They're just doing it electronically now. Just be really careful of that. And I think as you explore these new technologies like AI, please partner with your healthcare clinician, your health system, or some of these newer companies like Healthvana to help you learn how to do it, because it really is a skill. And we want to make sure you're doing it right because lives are at risk.
Beautiful. And Robin,
oh,
last
Lord.
word.
Yeah. Last word. Oh my gosh. Well, I would say that I think it serves all of us to really listen to everyone in the audience. And after looking at the toolkit that we put together, if we've left things out, if there are still questions, if we haven't addressed or provided information that is top of mind to you as you think about these issues, we would absolutely love to hear from you, because we would like to be able to continue to help you, and we don't know what we don't know. So I really would like to put out there a plea for helping us do what we're trying to do here, because it doesn't matter where you live or where you get your healthcare. Everyone has a right to healthcare and good information. And we just want to do everything we can to make that happen.
Well, I think that's a great way to end up. And I'll just say, as the moderator, I've been at this work for healthcare and caring for people in a variety of ways for almost 50 years now. I take this very, very seriously, this obligation, this accountability to help everyone be as healthy as they possibly can. And I'm so sad when I see the forces of mean people, malicious people, people who have very strange agendas, who try to manipulate people to not do what they should do or to do things that they shouldn't do because they're giving out bad information. We in healthcare care deeply about patients. We care deeply about consumers before they become patients. And we want you to be a better partner with us, and we need to be a better partner with you. That's what this is all about: caring together, having empathy for each other, and making sure that it matters whether we live or die, or whether our children are prevented from getting preventable childhood diseases and illnesses. That matters to us. So download our booklet. The information is right there before you. And I think Robin's point is so important. It is impossible for us on the first try to get everything that you want in it. This is your document. It is a living document. The NCL is all about serving you. So if we have something, if we've missed something or it's not clear, send us a note. We'll address it in the next version. I want to thank the NCL for this wonderful town hall. I want to thank blackdoctor.org for being the producers of this show. We appreciate it. And above all, thanks to our wonderful panel. But most important, thanks to each and every one of you that have tuned in. Thank you for doing it. Be safe. Have a good evening. Bye-bye.
Bye.
Thank you. Bye, everybody.